As you know, we have a rapidly aging population in the United States, and we need to do whatever we can to help our seniors recognize risk factors such as blood pressure, high blood sugars. Blood pressure is kind of you don't feel it, really. It's a silent killer if you're not aware that you have it. And if you discover it, you have high blood pressure, it's not the one instance that you're worried about, it's the years of a bombardment of high blood pressure that creates problems for your organs, your kidneys, your heart. I think local health fairs are very important to illuminate the many services, many of which are free, that are subsidized by the taxes that the senior citizens are paying to ensure that they are paying attention to their health care needs. Senior issues are very important to me. Especially senior citizens that own their homes. My goal is to allow senior citizens through a bill that I've written that once they become 65 years old, that their property taxes become frozen. They can't be increased by 2% per year because we have senior citizens that are living into their 90s and 100. So if you're 60 years old and you live 40 years longer than you expect to, by law, your property taxes can go up by 80%, which can price a lot of senior citizens out of their homes. And one thing that a lot of senior citizens have told me is that, Jeff, do something to protect us because we want to live in our homes as we retire. We don't want to go into a strange home. We'd rather bring somebody in to help us through assisted living in our own homes instead of going into an institution. We're here as a state senator today to let people know that we have an office in Indio and that we're here to serve you. And we get many people that confuse a state senator with the U.S. senators. They think that we're there to take care of federal issues as well as state issues. And we never turn anybody away. If they come and they have a Social Security issue, which is a federal issue, we will march them to their congressman and follow up on their case to make sure that they're taken care of. If they're getting an EBT card, which means that they're living on subsistence from the state of California, and they want to make sure they get their groceries, and we have a lot of senior citizens that do live in poverty that need help. We want to make sure that they're getting the benefits that they need and get rid of the bureaucratic snafus that sometimes can happen with governmental programs. And then, of course, senior citizens are the beneficiary of first responding agencies such as your paramedics, your fire department, your police department, your sheriff's department. This is a good variety of services that a senior citizen can take advantage of, and they can pick up a lot of great literature here. Magnets to put on the refrigerator with very important phone numbers that they need to call in case they need us. And so this is a great public outreach opportunity for the agencies to reach out to the senior citizens to let them know that, number one, we care, and number two, that we're there to serve.